say artificial intelligence in healthcare, this is a way forward, right? So the journey, I would say, from 2019, where someone introduced to me that, okay, why don't you do this particular certification in AI/ML? So that's where I entered the journey, and first 6 months I said this is totally a different thing, because the technology words are totally different, and then it's all about numbers and other things. But down the line, so as a capstone project for the certification course I was doing, I wanted a GPU. And then that's where I said, okay, how do you buy a supercomputer? That's why I just said, okay, came to know about Professor Fanindra and then met him. Then he said, hey, why not? We are ready to, collaborate, and then we can start working together. And so now within the hospital, where to find a space for this? And then, we need to talk to the management and everything. That's where our CEO Ramesh Kumar said, no doctor, we will do this. It is something, something very exciting. We identified a place within the hospital, and then a very small room. It was actually a dump yard. So we said, okay, we will convert that, and then we will set up here.
Because one of the biggest threat we have right now is that, including people like me, we all think that we have understood AI. And in reality, it's not about understanding the AI, it's about the application of the AI and how much it is going to really leverage the technology for either doing the diagnosis, or how much aid it is going to do the clinician. Is it going to bias, or is it going to help them to do better diagnosis? So that's the whole crux of the thing. So that means that the clinical evaluation becomes the most important part rather than the development alone. I think this way we are uniquely poised to do this application-wise and testing out in the hospital setting. And I'm really thankful for every one of you joining here and sharing the same enthusiasm as us in developing this application and then clinically testing it out. And of course, this is only the start. I think there will be more and more such things will come out. Even though I have to say proudly that this is the first model we have tested here, I think many more hospitals, many more settings will emulate this as we move forward. Thank you.
It's the patient. It is also going to help the patient. It's all about the patient-centric approach. Now, whatever business model, what we are going to come and why a clinician should adopt, the same is what we are also looking into. Any technology what we have brought into the hospitals also earlier, I think all our clinicians are adapted to the technology, and it is fast progressing because their motto is patient-centric approach, and the outcome should be in and around that, and also help the institution per se to grow within the given parameters. If we are there within those parameters, following the ethics committee, following the norms of the organization, patient consent, as rightly said, with all this, if it is fine, we are ready to go with partnering with anybody for that.
Early diagnosis, screening, and then a precision treatment that we can provide, and it can benefit to the patients and it can benefit to the humanity. So this is what the meeting was about, and also we showcased one of the product that we developed in collaboration with Indian Institute of Science, so that how it can be applied in real time, and how it can help in solving the diagnosis, or in in rationalizing the treatment for our patients.
So is it more effective, sir?
Yes. So any technology for that matter, say in healthcare, it is always the technology has made a big difference. Say for example, earlier a simple chest X-ray, it made a difference for chest diseases. Then you have a CT scan. Then similarly for the brain, we had a CT scan of the head, later on MRI. So likewise, the technology definitely aids the clinicians, and definitely it helps in screening, diagnosis, as well as treatment. In the same way, AI is also an additional technology that will definitely bring in a better change in terms of treatment and better care to our patients.
ಇವತ್ತು ಲಾಂಚ್ ಲಾಂಚ್ ನೋಡಿದ್ರಿ. ದಿಸ್ ಇಸ್ ಆಸ್ಟರ್ CMI ಮತ್ತು ಇಂಡಿಯನ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಸೈನ್ಸ್ ಕೊಲಾಬ್ರೇಷನಲ್ಲಿ ನಾವು ಈ ಮಾಡೆಲ್ ಅಂತೂ ತಂದಿದ್ದೀವಿ ಫಾರ್ ದ ಫಸ್ಟ್ ಟೈಮ್. ಇದು ಲೈವ್ ಮಾಡೆಲ್, ಯಾಕೆಂದರೆ AI ಅಂತ ನಾವು ಸುಮಾರು ಇದೆಲ್ಲ ನೋಡಿದ್ದೀವಿ. AI ಇಸ್ ಇಸ್ ಅ ಬಿಗ್ ಥಿಂಗ್, ಬರ್ತಾ ಇದೆ ಅಂತ. ನಾವು ಆ್ಯಕ್ಚುಲಿ ಇವಾಗ ಕಂಪ್ಲೀಟ್ ಪೇಷಂಟ್ ಸೆಂಟ್ರಿಕ್ ಒಂದು ಮಾಡೆಲ್ಸ್ ಅಪ್ರೋಚ್ ಮಾಡಿಕೊಂಡು ವಿ ಹ್ಯಾವ್ ಎನ್ಶೋರ್ಡ್ ದಟ್ ದಿಸ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಮಾಡೆಲ್ ಇಸ್ live and going with the support of Indian Institute of Science. So we are glad to say that as a hospital we are just not talking a topic. Now we have really gone into the acting, actually putting into the act.
ಸರ್, ಇದನ್ನು ಬೇರೆ ಯಾರ ಜೊತೆ ಆದರೂ ಕೊಲಾಬ್ರೇಟ್ ಮಾಡ್ತೀರಾ ಅಥವಾ ಈ ತಂತ್ರಜ್ಞಾನನ ಬೇರೆ ಯಾರಿಗಾದರೂ ನಿಮ್ಮನ್ನು ಅಪ್ರೋಚ್ ಮಾಡಿದ್ರೆ ಅವ್ರಿಗೂ ಸಹಾಯ ಪ್ರೊವೈಡ್ ಮಾಡ್ತೀರಾ?
ಇದು ನಮ್ಮದು ಆಸ್ಟರ್ CMI ಆಸ್ಟರ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ಅಂದರೆ ಇಟ್ ಇಸ್ ಮೋರ್ ಆಫ್ ಟೇಕಿಂಗ್ ಕೇರ್ ಆಫ್ ಪೇಷಂಟ್ ಮಾಡೆಲ್. ನಾವು ಬೇರೆ ಥರ ರಿಸರ್ಚು ಮತ್ತು ಬಿಸ್ನೆಸ್ ಅದರಿಂದ ಒಂದು ಇದು ಮಾಡಿಕೊಂಡು ರಿಸರ್ಚ್ ಇದರಿಂದ ಬಿಸ್ನೆಸ್ ಮಾಡೆಲ್ ಅಂತೂ ಮಾಡಲಿಲ್ಲ. ಇಟ್ ಇಸ್ ಸ್ಟಿಲ್ ಪೇಷಂಟ್ ಡಾಕ್ಟರ್ಸ್ ಇಂಟ್ರೆಸ್ಟ್ ಹೆಂಗಿದೆ, ಇವಾಗ ಡಾಕ್ಟರ್ ಲೋಕೇಶ್ ಅವರು ಇದು ಮಾಡಿದ್ದಾರೆ, ಅವ್ರ ಇಂಟ್ರೆಸ್ಟ್ ಇತ್ತು ದ್ಯಾಟ್ ಹಿ ಹ್ಯಾಡ್ ಡನ್ ಪ್ರೋಗ್ರಾಮ್ಸ್ ಕೋರ್ಸಸ್ ಆನ್ ಆರ್ಟಿಫಿಷಿಯಲ್ ಇಂಟೆಲಿಜೆನ್ಸ್. ಆವಾಗ ಅವ್ರು ಬಂದು ಹೇಳಿದ್ರು ಈ ಥರ ಪೇಷಂಟ್ ಬೆನಿಫಿಟ್ ಆಗುತ್ತೆ ನೋಡಿ, ಕ್ಯಾನ್ ಐ ಪಾರ್ಟ್ನರ್ ವಿತ್ ಇಂಡಿಯನ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಸೈನ್ಸ್, ದೆನ್ ಕ್ಯಾನ್ ವಿ ಗೋ ಅಂತ. ಆ ಥರ ಏನಾದರೂ ಮಾಡಲ್ ಇದ್ದರೆ ವಿಚ್ ಇಸ್ ರಿಯಲಿ ಗುಡ್ ಫಾರ್ ದ ಪೇಷಂಟ್ ಔಟ್ಕಮ್ ನಾವಂತೂ ಮಾಡ್ತೀವಿ. ಬಿಸ್ನೆಸ್ ಮಾಡೆಲ್ ಅಂತೂ ಇಟ್ ಇಸ್ ಅ ಡಿಫ್ರೆಂಟ್ ಸ್ಟೋರಿ, ಅದಂತೂ ಇವಾಗ ಏನು ಅನ್ಸ್ಕೊಂಡಿಲ್ಲ.
Artificial intelligence is mimicking the human intelligence to solve some of the tasks which are there in the healthcare. And this development is particularly related to the nerve ultrasound, which means that this will be able to detect any nerve abnormalities which are there in the humans, especially for the forearm, which is the arm part of things. So this algorithm, what it will do is that this AI part which is being developed will be able to clearly identify the median nerve, which is the main nerve in the hand, which will control all your hands movement and including your finger movements. So we are able to locate that, and then we are also able to help the clinicians to see whether there is any abnormality or any kind of nerve disorder in the forearm. That's the development.